Good morning. Today we have invited Dr. Sujith Senaviratne, Associate Professor, Director, Cardiac CT Service, Interventional Cardiologist, Monash Heart and Monash University. Good morning and welcome to the studio, Doctor.
Good morning, Sally, and thank you very much for inviting me.
What's your recommendation when you have a chest pain and you feel that you're having breathlessness? Do you go and get an echocardiogram, go and see your GP? What's your recommendation? And the CT scan that you have, that you operate and you manage in your environment, what is the best way to do it?
Right. I mean, the first step, of course, is to actually go and see your GP, because I think GP is the most important link that you have to the health system. You would need to go and get your risk factors looked at, get your story looked at, and then GP may organize some investigations for you if the GP thinks clearly it is unlikely to be coming from the heart, or he may think that these symptoms are a higher risk, therefore he or she may refer you on to a cardiac specialist. Now, just to kind of give you background, what kind of tests are available. So the most commonly used type of modality to investigate chest pain is what you call an exercise stress test, where we hook you up to an ECG and ask you to run on a treadmill, walk and then run on a treadmill. And then we have what you call exercise stress echo. That's the more commonly used modality these days. And again, what we do there is to look at the electrical system or the ECG and look at the engine room, that is the heart function, under stress. And we make an assumption if you do well under stress with both electrical system and engine room performing well, then we assume the plumbing or the coronary arteries are satisfactory. And the accuracy of these stress tests are ranging anywhere between 75 to 80 to 85%. So these are what you call non-invasive, relatively simple tests. And if the symptoms are pretty mild and atypical, and that may be all what you require. However, if you have a strong family history, or if the story is somewhat more suggestive, perhaps you would need to go and see a cardiologist and go to a higher level of investigation. And when you talk about higher levels of investigations, we have two techniques to look at your plumbing system or coronary arteries directly. One is, of course, to do the invasive test, which is angiogram, and that is usually done through the wrist these days. In the past, it was done through the groin. These days, more commonly done through the wrist. Or the newer technique is what you call cardiac CT. So cardiac CT is no different to a CAT scan that you've heard about. The beauty of this particular test is that it does not require anything invasive at all. While invasive angiogram nowadays is very simple and takes 10-15 minutes to do, still carries very small but definite risk. Whereas having a CAT scan or cardiac CT actually is virtually risk-free procedure. And it's done simply by giving the same dye that we give for the angiogram, but given through a small cannula or small needle, which is pretty much what you use to get or give saline. So a very simple procedure. All what you need to do is to lie on a table, stay still, and we give the contrast through the drip, and we can see even a very, very small quantity of cholesterol in your coronary arteries. And the accuracy of this test is about 90 to 95% when compared with angiography. Perhaps I can show you a couple of examples here. So this is a typical cardiac CT scan. As you can see, this is something pretty straightforward, and you pretty much lie on the table, which you can see right next to the CT scanner. What I'll show you next is some images of a patient. This is a patient who has been getting some chest pain but had a stress test which was told normal. So this example is to tell you that simply because a stress test is normal, it doesn't always mean that you don't have a problem. And that's why even if the stress test is normal, and if the symptoms are still there, you would need to go back to the doctor, and so that more advanced investigations can be carried out.
So if it comes out normal, why would you want to do a bit more, Doc?
As I mentioned, exercise stress testing or stress echo, these modalities have a limitation. They're very simple to do. Therefore, at the same time, they're not as accurate. So the accuracy is between 75 to 85% in picking up something significant. So in this example, what you can see on the left two images are what you see on a cardiac CT. You can see where the two arrows are, and those arrows reflect severe narrowing on the artery on the front of the heart. And on the right hand images where it says angiogram is the image that you get when you do an invasive angiogram. That means this patient either had angiogram through the wrist or the groin, and we inject dye directly using a catheter. Once we find the coronary artery, and you can see the same narrowing there, very severe narrowing in the front artery. And as I said, this is an example where the patient was told that he had no problem because he had a negative stress test, and yet the CAT scan found a severe narrowing and was confirmed with the angiogram subsequently. And similarly, you can see another patient here. This is a 50-year-old female and had a positive exercise stress test. And often in this situation, patient would be recommended to have an angiogram. But we know that the risk in females is actually lower than males, particularly in younger age group. So despite the stress test being positive, this patient again went for a cardiac CT. What you can see here is the patient's heart, and you can see the lines on the front of the heart. Those are coronary arteries, and similarly on the other pictures again showing the coronary arteries, and you can see that this patient has not even a tiny dot of cholesterol. So despite a positive stress test, this patient has no cardiac issue, no coronary artery disease, and therefore avoided the need for invasive test. And so that very much highlights the value of the cardiac CT. And as mentioned, it is about 90 to 95% accurate. So for a significant proportion of patients, you can give a clear answer without resorting to invasive angiography.